Welcome, everyone. Thank you so much for joining us this afternoon for our panel on rethinking health equity, building trust, empowering our own, and the resources we need to heal our communities beyond COVID-19. My name is Opal Tomashevska, Director of Multicultural Business Strategy at CUNA Mutual Group, and I'm extremely honored to be here with some of the most brilliant medical and health equity minds in the state. So just to set the stage a little bit, I'll do a brief introduction of our esteemed panelists, and then we'll get right into our discussion, hoping to leave about 15 minutes for Q&A at the end. But please use the chat to put in any questions that you might have throughout the discussion, and then we'll get to them during that Q&A portion. Please also use that chat to put any thoughts and comments and reactions that you have as well. So now we'll get into introductions. Just believe me, it'll feel like a lot, but I'm just hitting the iceberg on these amazing folks. So I strongly encourage you to go ahead and learn more about the great work that our panelists are doing across our great state and nation as well. So first, I'll start with you, Dr. Zapata. So Jasmine Zapata is a double board certified physician specializing in the fields of pediatrics and preventative medicine. She currently serves as the Chief Medical Officer and State Epidemiologist for Community Health within the Bureau of Community Health Promotion at the Wisconsin Department of Health. That is a mouthful, and I'm just getting started. She provides expert guidance for a variety of public health promotion, planning, and policy efforts. In this role, she serves as co-chair of the Governor's Health Equity Council Subcommittee on Power, Access, and Representation, as well as being co-chair of the Wisconsin Maternal Mortality Review Team. She's also an assistant professor at the University of Wisconsin School of Medicine and Public Health, and she practices clinically in the newborn nursery and is involved in a variety of scholarly activities aimed at increasing diversity in medicine and promoting health equity. She's got many lived experiences that help her uniquely connect with the communities that she serves, and her ultimate mission in life is to heal, uplift, and inspire. So welcome, Dr. Zapata. Thank you so much for being here with us today. Next, we have Dr. German Gonzalez. He is an MD with an MPH from Emory University. He joined the Great Lakes Intertribal Council as the Tribal Epidemiology Center Director and Medical Epidemiologist. He's responsible for planning and implementing technical assistance, public health practice, research, and epidemiological support services to tribes and urban native health programs in the three-state region of Wisconsin, Minnesota, and Michigan. Dr. Gonzalez has also worked at the local state public health in Georgia, Washington, and Florida, and in several different programs, including epidemiology, infectious and chronic disease, informatics, education, and training. Dr. Gonzalez has also been active teaching public health at the graduate level for 13 years. Dr. Gonzalez, welcome. We also have Karen Menendez-Coller, PhD. She is the Executive Director of Centro Hispano of Dane County and has been so since 2013. She is originally an immigrant of El Salvador and holds 20 plus years of community-based experience working across multiple sectors. Centro is the leading organization in Dane County, prioritizing vibrant, thriving, resilient Latinx community through holistic, family-centered work that is grounded in community voice. She was also highlighted in 2016 by Medicine 365 as one of the most powerful Latinos. She also received the inaugural Nan Cheney Award for Social Justice from Forward Community Investment, shout out to FCI, and was also named as a National Hispanic Heritage Foundation Leadership Award recipient for the state of Wisconsin in 2017. Awesome. And Karen, thank you so much for being here. Great to see you again. And last but certainly not least, we have Gail Nahwahquaw. She is the director of the Wisconsin Department of Health Tribal Affairs Office. She is a member of the Menominee Nation and works with her team to administer health services to tribes and educate employees within the Department of Health Services about different tribal communities to ensure that services are culturally appropriate. Extremely important. I thank you for that. Her office works in partnership with the Wisconsin's 11 federally recognized tribes, the Great Lakes Intertribal Council, and the Gerald L. Ignis Indian Health Center to aid communities. So Gail, welcome. Thank you so much for your time and expertise here. Thank you for all of you for being here, sharing your expertise with us this afternoon. And without further ado, let's talk. First question, really to kick this discussion off, I'd like for each of you to touch on this, if you will. How do the disparities that we see in COVID-19 reflect the already existing social and health inequities for our Black and Brown communities? And if you can also talk about how that includes access to education surrounding the pandemic as well as vaccinations. And if you wouldn't mind, Dr. Zapata, can you kick this one off for us?
Ooh, I just knew you were going to choose me. I just knew I was going to be first. I have a lot of thoughts about this, but this pandemic has definitely exacerbated already, I would say, broken system that we have had in place. It just really almost like the visual of a flashlight, just shine the light on some things, and almost like a rug where it's kind of like, if there's things under the rug and you just lift it up and it shows everything under there, that's definitely what COVID has done in this situation. One thing that I think of in particular is as it relates to our birth outcomes and already existing inequities and disparities in birth outcomes, particularly among certain populations. In particular, one of my areas of research and areas of expertise is in Black birthing justice and birthing outcomes. We already were seeing that, for example, Black women who were college educated Black women had 2 to 3 times higher chance and rates of preterm birth compared to white women who were high school dropouts. So we were already seeing these inequities and disparities. But what some of our preliminary data is starting to show even now is that in the midst of this COVID pandemic, some of those inequities are already worsening and are increasing. So that's a reason why we need to especially be having conversations about how do we heal from this current situation, but how do we prevent that from happening in the future as well. So this topic is extremely important and definitely has shined a light on already existing issues. And that's just one example, but I'll pass it on to some of my other colleagues to give their thoughts.
Yeah, absolutely. I love that flashlight. Absolutely. I work in finance and see the same thing. Just shine a light on this stuff. Gail, if you wouldn't mind taking this question next.
Sure. Thank you for that. I seeing that question really have to go, I think, to the deep end of the impacts of COVID in our Native communities, and that really has been the morbidity, the death rate. Native people, I think, across the country have died 2 and 3 times faster as a result of the infection with COVID-19, and that, I think, to use Dr. Zapata's analogy of the flashlight, just really shows the comorbidities that tribal communities already have, high, heart disease, obesity, diabetes, all of that once infected with COVID, just are compound the impacts of that. Losing tribal communities here in Wisconsin have lost traditional knowledge keepers, first language speakers. So it's been a pretty significant impact in our communities, just with the death rates from COVID.
Thank you. Thank you. Karen, would you like to add in?
Yeah, sure, Opal. Thank you so much. It's really wonderful to get a chance to be here. I'm always very selfish about the summit because this is the space where I feel like I can heal myself. I don't have many spaces in the city, in the county, and the state that I feel that way. And, I think with COVID, a lot of that became extremely real for communities of color. I think echoing Dr. Zapata's comment about systems being broken, it's something that we've known all along, but during a time of crisis, it's heightened even more. When educational systems, city, county, housing supports, all these different pieces, there isn't anything in place to address, in our case, the Latinx community, which is a community that we work with at Centro. It's a huge concern, and it's a huge stressor that poses a significant amount of trauma. in communities that have already been affected for a very, very long time, that have had to carry the stress and the burden of living in spaces where we oftentimes don't feel like we belong. So I think COVID-19 has really amplified that. My hope is that it will be a wake-up call so that things eventually change, so that we end up having better birth outcomes. Data recently showed infant mortality rates for Latinx moms doubled recently. And so what do we do moving forward so that we learn from this and that we actually can do better and we don't end up being reactionary, but be more preventative so that our communities don't need to suffer anymore?
Yes, yes. Dr. Gonzalez, please.
Well, this is a challenge. I mean, being the first one and the last one, because you all have said many things. However, I will use my analogy because I am frustrated, and I know Dr. Zapata has heard me saying this before, that the problem with I'm sorry, just a second. The problem that we have with COVID-19 is that, to me, the offensive part is that people seem to be surprised. COVID-19 is a slow train wreck, which it make really uncomfortable everybody because it was a time machine, because it slowed time. And people were starting to see all these bad things that happened to our communities, and they couldn't hide it. They couldn't just create another news just to hide those problems. The high mortality, the chronic diseases, all the comorbidities. And just simply, I keep telling people, why are you surprised? These things have been happening for years upon years. Now people have to face it. And this is the uncomfortable truth that we don't have what we need, and we need just to do something. People cannot look away. So it's in their face. So we have, I'm sorry, I just get really excited about this and really, really mad.
No, I feel you, and I appreciate it, and I can feel and hear that passion as well. I mean, just the first question, and you all are already uncovering just amazing things. I'm thinking that we all have seen the mortality rates from COVID, but we don't hear about the cultural impacts. Gail, as you're talking about the traditional knowledge and language keepers, and as we're talking about infant mortality rates. So thank you all so much. I'm super excited for this. Okay, so that first question, really talking about what we're seeing. As a follow-up to that, can we talk about some of the actions that you're taking to address how health inequity is impacting our communities, and then how the pandemic will continue to impact us going forward? Because as I can imagine, it's not going to be over even when the COVID-19 pandemic is no longer top news. So Gail, if you wouldn't mind taking this one first for us.
Sure, thank you. Our Department of Health Services actually is really doing a lot of work around health equity. I'm so pleased to share, and it's probably, but we have established an Office of Health Equity that will be housed within our Office of the Secretary, and have the director hired, Dr. Michelle Robinson, who we were so lucky to get after a national search for this director position. She is starting in that office next Monday, as a matter of fact. So we will definitely be on track to really focus on our work on health equity. But prior to that, even various divisions within our department, we're taking on this activity. Our Division of Public Health established a health equity advisory team probably 4 years ago now, really just to work within that division, because the staff that founded that just were hearing stories across the division, about work in the department, and just really felt like maybe they weren't being heard. Our communities of color, our BIPOC staff members, just kind of sharing with each other, and then just thinking about the work across the division in public health. So did some really, really good foundational work, conducted a survey across the division to try to focus the work of the HEAT, it's called. And some of that work became the basis for establishing our Office of Health Equity. Funding, we've received some opioid settlement dollars that we will be, a piece of that funding will go to prevention efforts, because we've seen through data that tribal communities and African American communities have been disproportionately impacted by opioid overdoses. And so we'll use some of that settlement dollars in those communities to really work on some prevention efforts around opioid use disorder. We also, in our maternal and child health, have hired some specific community coordinators to work again in African American community and Native community, looking at the infant mortality and helping to address those impacts as well. So we are doing, I believe, a number of activities in our department to help address health disparities and the health equity across our state.
That is a lot and amazing progress. So thank you for doing that work. Karen, how about you?
Yeah, so this is something that when I took my position at Centro 8 years ago, it was quite a shift in my career. But I really believe that that grassroots level of community building is really necessary for balancing out and pushing against the systems of oppression that create all these inequities. So I think for us at Centro, we really see this as a healing process where we really see the journey of the immigrant community, what we see across different spaces nationally, and where we are here in Wisconsin, and an understanding that to make sure that these inequities don't impact us detrimentally as they have in other parts of this country, because they can, as they have so many communities of color, we need to have healing spaces, and we need to have spaces where we're really digging into our identity, our connections, our history, and really building that resilience and that hope that can only be grounded when it's really done in the community. And so, we were really lucky because right before COVID, we started a project in partnership with the School of Education at UW-Madison to create a pathway of Native Spanish-speaking therapists, mental health therapists that could work here in Dane County and address the deep bilingual, bicultural gaps in our community. So that's a project that has been ongoing and that we will keep going, but it's also something that has been really beneficial for our staff. 95% are whom from the community that we serve. I wouldn't be here if it wasn't for spaces like Centro that allowed me to believe in myself and for my mom to be able to see that there was a future in this country. And so we've been able to connect the dots a lot more. And I think that's what's been a priority for us. We've always been a hub for creating innovation for the community because we've come to understand that the systems in place have not addressed our needs. And as much as we ask that they do, as much as we show them that our families deserve that, sometimes it's very difficult, it's traumatizing, and it's challenging. So we try to leverage all these possibilities to create connections. I'm really grateful that Centro is a partner of the Latino Consortium for Action here in Dane County. 15 grassroots organizations, councils, associations that come together and create strategies. That's how we want to make sure to reduce health inequities for our community, to really create practices of healing, but also create solutions that are grounded in the voice of the community, because if we wait for others, it just doesn't seem to happen quickly enough for us. So.
Ooh, yes. Question 2. I'm already, you almost made me cry, Karen. I just feel the passion and well up and the pain when you talk about your mom too. That is amazing. Thank you. So thank you for that. Dr. Gonzalez, please.
Well, I must say, I mean, I'm just extremely blessed by the support of my leadership. But what I'm saying, everything just comes from my heart, and it's my opinion. I wish I could do more, and my team do more for communities. However, I am a strong believer on creating just empowering our communities to take charge of the things that have to be done. Again, I'm saying not that they don't have that power, but we have to adapt. And just I'm attempting to use the linkage between the modern data collection and the wisdom of our elders and our communities. We have to establish base and the resources necessary for them to react and to collect and to take decisions based on the information that they have available. So one of the, not because I do data, because data, one of the things that I have learned, and it has been clear for me, is that data without the stories behind is just simply numbers. And those numbers, they can care less. But as Gail was just saying, we have been affected tremendously by losing that memory and those roots for our communities just to this pandemic. So if we can establish and we can help, this is what we are trying to do. We're attempting to create infrastructure that it will provide them to take care of their data and their decisions, and that infrastructure to be there, because it seems like we are witnessing that people have in the other areas, I'm not talking about communities, they have short memory. So we want to create a system that they can use not now, not in 5 years, but 10, 15 years, and keeping our generations healthy and thriving by creating something right now that we can use.
Thank you. Y'all are dropping gems. What was that? Did you say data without the stories behind it is just numbers? I mean, that's somebody needs to tweet that out. I'm going to tweet it after this session. Absolutely. Thank you. Dr. Zapata, if you wouldn't mind adding in on this one too.
Yes. So there's many great things that are happening, and thank you, Gail, for highlighting some of the great work happening at Department of Health Services and some other things going on within our Department of Health Services, particularly within our Bureau of Community Health Promotion. Earlier, I mentioned the impacts of COVID-19 on maternal and child health. One of the roles that I have the honor of being in is being the co-chair of our Wisconsin Maternal Mortality Review Team. And on the Maternal Mortality Review Team, we review all of the deaths of pregnant people who died during pregnancy or within a year after pregnancy. We look at the autopsy. We're able to get the autopsy records, the health records, and other records surrounding around that death. And we look at some of the upstream factors that led to that death and ways that they can be prevented. And so already we have seen inequities and disparities in some of our maternal mortality rates. But what we're seeing, some of the preliminary data is showing that, again, some of these inequities are worsening in the midst of COVID-19 pandemic. There was just recently a CDC report. It was a health alert that came out basically talking about some of the high rates of deaths in pregnant people from COVID-19. We've also been seeing that there have been increasing rates of overdose and mental health issues in that are factors that contribute to some of these maternal deaths that we're seeing. And so some of the things that we're doing about that to mitigate some of the negative impacts of COVID-19 on birthing people and figuring out ways that we can prevent it and work on it for the future is that we're in the process of advocating for funding so that we can do family interviews, because just as Dr. Gonzalez mentioned about the importance of stories, when we are interviewing or when we are collecting this data about maternal deaths, it's a lot of records, but we're not really talking to friends and partners and family members to really get to the root cause of what led to some of these deaths. So that's one thing that we're advocating for. And also we're in the process of forming action teams where when our committee comes up with recommendations, we don't want just a list of recommendations sitting there. We have been undergoing strategic partnerships with different health systems and community organizations and things so that we are able to actually take these recommendations and the things that we learn and at even more of a rapid and urgent pace, turn these recommendations into action. And so those are just one example of something that we're doing within our Wisconsin maternal mortality team to be able to mitigate the impacts of COVID and then lessen them for the future.
Wow. Thank you all seriously for the work that you're doing. You're literally saving lives and communities. For that one theme that I feel strongly come through from all of you is that, yes, things have been exacerbated by the pandemic, but y'all have been looking into this since way before and seeing these disparities and these differences. And it just reminds me how important it is that your organizations are led by folks of color and are making these decisions and have that vision to have seen this even before it came. So again, I can't say thank you enough just for the amazing work that all of you are doing. For this next question, I'd love to get especially input from Dr. Gonzalez and Dr. Zapata, but anyone could chime in on this as well. How important is it for healthcare professionals to invest within the communities that they serve? And I'll go to you, Dr. Gonzalez. I see your face already responding to that one.
Well, I would have preferred Dr. Zapata because she may be able to do something smarter than me, but as I have been transplanted to many different places, one of the things that I have witnessed with more despair is finding people that work serving people, that they are not invested in their communities. And I will say something silly. I moved here, next day, I had my license plate and my driver license. I didn't stay like 3-6 months just because I'm here. Here is where I brought my son, the person that I love the most. Here is where we're living, and here is where our future stays. So if I have my family safe, I want to have the people that I'm serving equally safe. So healthcare providers, I mean, come on, we supposed to, when we are doing clinical care, I remember this from medical school, they tell me, you are the normal. So you have to compare your patient with yourself. So can I just do that if I don't care about the community that I'm serving? It will not take me anywhere. So it's not just simply that you are receiving or just providing care and you're receiving a salary. Is that you have to provide care to those who you care for, like you care. That's the fun play in English, but you really have to care for the people. Otherwise, it does not mean anything. It's like the numbers. You just simply just giving a Tylenol and see you later. So we have to be emotionally invested in our communities. Otherwise, we just simply just being a pill dispenser or a change parts person. And that does not work because, as I want to say, not diminishing from other communities, but our communities of color, I mean, that's what we call ourselves. You have a brother and you are part of myself. We look equal. I know I don't have to tell you how difficult it has been for me. It has time in this country that I love being the only different person in many places. It don't matter how I look. It doesn't matter how I sound, but I was the oddball everywhere. Start with my name. So it doesn't matter. I'm part of the community and I'm serving the community. So I didn't make any sense, but Dr. Zapata, help me.
That makes a lot of sense. And it's just so important to get outside of, especially as healthcare professionals, get outside of the clinic walls and really understand that one's health, one's quality of life and length of life, only 20% is really based off what happens in the hospital and clinics. That's one of my favorite. I remember, I'll never forget when I started medical school, I was I was upset when I saw this graphic by the county. It's the county health rankings model, and it basically just shows that only about 20% of health outcomes is based on what happens in the hospital and clinics. The other 80% is based on one's individual behaviors and beliefs, social and economic factors, and one's environment. And I was like, I spent all these years, a lot of years, 20 plus years to be a doctor and work inside the hospital because I thought that was the biggest way to impact someone's health. What better way than to be a doctor? And then I got to medical school and saw like, no, you're only impacting 20%. And so that is what personally it impacted my career path and in a variety of other personal and professional situations to go into, after pediatrics training, go into the field of preventive medicine and public health so that housing, combating housing inequities, going to focus on social connections, focusing on reforming our criminal justice system, going and working with schools. That is I'm being a physician just as much as I am giving any type of medication. So I believe that's the future of what we need to do in order to heal our communities, looking at hope and healing in the future. And the last thing I'll say about this is when you want people to trust you, because we talk a lot about distrust with the healthcare system, particularly with the COVID pandemic, the vaccine and things, we need to have trust with our patients and our communities. And trust is more than just building credibility, having my white coat on or saying I'm a doctor or reading off my bio and show I'm credible. In order for people to trust us, we not only need to be credible, but they need to know that we're reliable. Are we just coming in communities and having these conversations, giving education, telling them what to do, and then they don't know who we are, and then we're going to just disappear for the future? Or have we been right alongside them for years and years? They know who we are already, and they know we're going to be there. So being reliable is important. And then finally, they need to feel safe with us emotionally as well. So those are the three components of trust: reliable, credibility, and be able to feel safe around you. But why what Dr. Gonzalez was saying is so important, that we invest in our communities, is so that we build that trust. That is a key way to build that trust. When we care about the basic needs of our community members and our colleagues, that is what is going to really have big benefits in the future, because that's just a way to build trust. And we are the community. It's not me and them. I mean, it's just us. We're all in this together.
Woo, amazing, amazing. Thank you. Yes, yes. Trust is more than just building credibility. Wow. Thank you both. Absolutely. I wish every care provider could hear what y'all just said, because that was a knowledge drop. Thank you. Thank you. Go ahead.
Can I quickly
Yes.
just add? I mean, so for tribes, they all have federally qualified health centers, right? They all operate their primary care clinics and take great pride in being able to provide that service, because it's taking care of their own. And I've heard Denise Palmer. She works for us at the department in our Medicaid services. She's tribal member, but to quote her, saying that, tribal people, we take care of our people better than anybody else. We know them better than anybody else. And so I think tribal communities definitely take great pride in the clinic and the health services that they provide to their community members. And I think in this last year have done a phenomenal job at addressing the pandemic and getting vaccines out there. And they are, as Dr. Zapata said, they are the trusted source within their own communities.
And if I make just a little plug for this, something that I just forgot, that other thing is that the providers in our tribal clinics are not that quick to dismiss something that is also important in the culture, in the clinics, in the nations, which are our traditional healers. From those that I have learned, and I learned from those in South America as well, I learned to listen. And our traditional healers are not dismissed by at least the providers in our tribal clinics. And we are looking forward just to learning from them and working alongside. So that's another aspect that I didn't mention.
Thank you. Thank you for adding that on, both of you. Love that. So when I'm hearing Dr. Zapata and Dr. Gonzalez talk about what it takes to be a care provider, how important that is to be connected with the community. I wonder, Gail, you touched on this a little bit, but if Karen and Gail could both kind of hit on what your organizations are doing to make sure that there's access to primary and specialty care for the folks within your communities.
Should I go, Gail? All right. Well, I think, sorry, I'm still reflecting on everything that was said. And I think one good thing that we do is connecting some of our young people who may be on listening to the beautiful messages that Dr. Zapata just mentioned and what she represents. I guess I'm going to make that comment. But, for the work that we do at Centro, I used to do some work back in California with pregnant women. That was my area of interest and community that I was very familiar with. But I used to go to Access. They used to have a prenatal support group for Spanish-speaking moms. That was very vibrant at the time. I don't think it is as much anymore. But something that really stood out to me was the sense of isolation. Some of the women that were there lived across the street, but other than that visit to Access for that group, they wouldn't venture out if it wasn't because their partner was home. Their partner could actually go with them and walk them there. And so it's this tremendous sense of isolation and lack of visibility that I think we see a lot in the Latinx community here. And so for me, partnerships with Access literally across the way from where Centro is located have been really key and instrumental. Kind of going back to what I was talking about before, just connecting the dots. How can the work that we're doing around well-being, mental health support complement some of the behavioral intervention work that they're doing? Centro also, through the Latino Consortium for Action, works very closely with the Latino Health Council that has been around for 20 plus years in the community, doing a lot of preventative work. Dr. Patricia Tellez-Heron has been in the community forever, working in family medicine. And I think it's important to connect community to these individuals for what they represent and for the sense of hope and resilience that they provide, because that's very important too when you're thinking about preventative work. Centro has one of two Spanish-speaking health insurance navigators in the entire state. So actually, we do a lot of health insurance access. We do a lot of marketing, promotion, communications, campaigns, so that our community feels comfortable looking at what resources are available. And I think a big point of pride for me is that we did a lot of work around how to engage community about 8 years ago. And food really stands out. This idea of the land, this idea of talking around tradition and cultures tied to food. So it's been paused because of COVID, but we actually have a space called Mercadito de Centro, where there's farmers there that are immigrant, indigenous, that are a part of vending at Mercadito. It's a space for community, for conversation, for social capital to be built, but also for healthy foods. And that's very, very important for our community. So those are some of the approaches that we've been investing in.
Thank you, Karen. So for us at the department, I think the work that we're doing to improve access to primary health care and specialty care is primarily through our Medicaid program. I shared in the previous question that every tribe in our state operates their own tribal health center. So they negotiate with the Indian Health Service on the budget for that, to provide that service to their members, and Gerald Ignace Indian Health Center in Milwaukee. But it's not, those clinics are not funded at the level of need. I've heard quotes from health directors saying that they're funded at less than 50% of actual need for those services. And so the way Congress chose to help lessen that gap was to allow tribal health centers to be able to recoup reimbursement for Medicaid services. So tribal health clinics can get reimbursement for Medicaid, and the federal government will pay for all of that cost. And it was primarily for the services within that health center. But the Centers for Medicare and Medicaid Services in 2016 reinterpreted that policy to say for services outside of a tribal health center, if that health center, that tribe has a coordinating care agreement with an outside provider, say for renal care or inpatient services, that as long as the patient remains with the tribal health center, they can also get the enhanced reimbursement for those Medicaid services outside of the clinic. And just in this last state budget cycle, we, Department of Health Services, was able to get a provision passed that will allow us to, if we realize that enhanced reimbursement for services outside of a tribal clinic, we'll be able to reinvest those dollars back to those tribal health centers. And it's fun. It's money that we've not been able to capture before because we didn't seek that reimbursement for those services outside of a tribal health center. So those are some of the things that we are doing at the department through our Medicaid services program.
That is awesome. That is awesome. Thank you both just for the ways that you're helping to provide access and think around some of the underfunding barriers and resistance and things that have traditionally plagued our communities. So kind of back to thinking of everyone thinking about this question, if you would, with that, what policy changes would you like to see to increase the equity within healthcare? And I'll go back to you, Dr. Zapata.
Yes, well, there's a lot of changes I would like to see, but one of the biggest ones is finding ways to mandate and create a sense of urgency around addressing our lack of diversity within our healthcare workforce. There is a lot of implicit bias training and anti-racism conferences going on. Those are important. But in addition to helping people undo their biases and learn and dismantle racist systems, in the midst of that, we need to increase the diversity of the healthcare providers that are providing it, period, point blank. All the money that we invest in all these trainings and implicit bias education pamphlets and mandatory modules, okay, that's great. But in the midst of that, let's increase our amount of Black and brown providers so that when patients come in, especially those that are most impacted by some of these inequities that have distrust with the healthcare system, they can come in and be treated by people who understand without you having to say anything. They can understand your background. They understand some of the situations that you go through. You don't have to walk in and explain how hard it is to be a Black woman in America, because you could just walk in and we see each other and we just know without having to explain that. And that's not me just having that these sentiments. I know I'm strongly opinionated, but it's not just me saying that. There's research and data and evidence that's showing improved health outcomes when you're able to do this. Also, this is what our patients are asking. As part of some of my research that I do, I'm interviewing one-on-one in-depth interviews with Black women in Dane County saying, what do you need from your own mouth? What do you think is needed to combat some of these inequities we see? What do you need to trust the healthcare system more? And overwhelmingly, we're hearing, we want healthcare professionals that look like me. I need healthcare providers that look like me. There's a lack of diversity, and there's much other research that has shown that as well. So that is something that I would love to see policies around and a sense of urgency around. How can we have our healthcare workforce just simply reflect our population?
Amen. I don't know if you saw me clapping, but I 100% agree and can relate. Yes. Thank you. Thank you. Gail, if you wouldn't mind touching on that question as well.
Sure. I mean, I think kind of in that same vein, Dr. Gonzalez brought up traditional healers, and that's what we're hearing, and we've been hearing it for a number of years now from tribal communities. But to figure out ways that can better support traditional healers within their tribal health systems, and be able to help them get reimbursed. So I just talked about the reimbursement in the previous question, but have Medicaid recognize those healers, those traditional healers, so that, I mean, it's been a long standing effort, but I think the data that Dr. Zapata just quoted about, there being better health outcomes by providers that look like you. I think that same thing goes for traditional healers. A member coming in and wanting to be treated holistically, not just for their physical health need, but those traditional healers address on a spiritual level, on an emotional level, on that physical level as well. And so it certainly is and achieves those better health outcomes to be able to have access to those traditional healers.
Absolutely. Thank you. Thank you. Karen.
Sorry, I was having issues with my mute button. I think a lot about the policies that are impacting health that happen way before you get into the hospital or clinic or that kind of situation. But when I'm always asked about policies, I think about like immigration reform going to be decided this week. So many of us at Centro are on pins and needles because this could determine so many things, the level of trauma that our community is facing and that impact the health and well-being of our community. Loan forgiveness, in terms of like building capital and wealth in communities. How can we create policies that are going to be supportive so we can have thriving communities? I was watching a panel, I think it was 2 days ago, or might have been yesterday, on what is a thriving community and how you need to invest in it. That really stuck with me. So here in Wisconsin, in-state tuition for many of our documented, undocumented students, because that really affects their health and well-being and would provide equity in healthcare if they actually were in a state where perhaps the use of healthcare was reduced for emergencies or dire circumstances. So I think about all of that in terms of, healthcare itself. Building off of some of the comments that were made, I really wish there was greater alignment and some policies and structures that would create greater alignment so we could have these conversations in a more structural way, and that all these wonderful brains and minds could come and create a policy for the state that's really driven by the community. So that's something that I wish that there was a strategic vision and collaboration or an officer for that kind of work at the state level. So.
Thank you. That thriving community and that financial piece is near and dear to my heart as well. So thank you for that. Dr. Gonzalez, we'll go to you, and then after that we have a question from our audience that we'll hit.
Again, highly difficult just to follow these three amazing ladies, and after Dr. Zapata mic drop is more difficult. But I will say that one of the things that I have not heard is a little bit more effort on supporting policy that supports the expanded scope for professions. So wherever, it's not that we will get or settle with not the best treatment, but allow that when we have, we create programs that expanded scope for dental assistants, just to do some, we have that program at the state, and just make sure that we can just have the training and the education for those in communities to access those opportunities to be trained to serve our communities. So the Affordable Care Act, and when we start seeing that more nurse practitioners were taking care of patients, I'm proud to say that my provider is a nurse practitioner. I don't see another physician. But that increases the ability for people just to have the access that they need, at least in that moment. So policies that support that expanded scope for professions, it will be something that will be welcome.
Thank you. Yeah, that provider perspective is huge. So thank you so much for that. Our audience questions that we'll go to, there's a couple of them that are kind of similar here, and it kind of builds on what we're talking about now. But folks would like to know, how do we advocate for the changes that all of you are talking about? And how do we talk to local leaders? So anyone can chime in who's got thoughts and ideas on that one.
I have one quickly. So within the Department of Health Services, I have the opportunity to co-chair the Governor's Health Equity Council Subcommittee on Power, Access, and Representation. And so the Governor's Health Equity Council was created by Governor Evers via an executive order last year. I believe it was Executive Order 17, but I would have to, I'm pretty sure it was that one. But the point is, it brought together 33 council members from across the state, representing different elements of health equity and different populations, communities. And we are charged with creating recommendations to submit to Governor Evers, which we're going to be submitting early next year, to achieve health equity by the year 2030. And so there's many different subcommittees, and I'm co-chair of the subcommittee on power, access, representation. There's other subcommittees related to policies, equitable investments, and framing. But the point is that I'm trying to say is that these meetings that we're having right now, as we're drafting the recommendations, they're open to all the public. And so if you just if you just Google Wisconsin Governor's Health Equity Council, you will be able to find the link that has all of the meeting times, and they're all via Zoom. So no matter where you are in Wisconsin, you can join in, and there's always time at the end for public comment, and there's ways to get involved. So I would highly encourage you, the time is right for right now, you get involved. And regarding local issues, just reach out to whoever that person is that is in that leadership position that is impacting the issue that's important to you. Just shoot an email, show up if you have to, be persistent, because your voice matters.
Awesome. Thank you for sharing that information. I did not know that those were open to the public too, and via Zoom. If I can do it from home, even more apt to do it. So thank you for sharing that. I would definitely be looking that up this evening myself. Any others wanted to chime in and add to what Dr. Zapata shared with us on this one?
I think that, and this is just simply stating the obvious, but one of the things that I have promoted is just to have all our communities be on the same page. The use of data and or stories, as I said before, together. I will just give an example. If we have the data and we have the voice of the people and just together with that data, and we present it to those who need to address the policy, how can they say no? Well, we know, they say no, but we have the power just to speak, and not just simply because we're going to stomp our feet on the ground, but we're going to get together or memories or experiences and information and data, and make a clear statement that people see that we are together and we are one pushing, because division is what it gets us. They pitch us against each other, and we just buy the thing and we start just fighting each other in disparate directions. If we get all together and talk, just make our voices be heard and put our foot where we have to put it.
Amen to that. Amen to that. So important that we are on the same page and working together. Huge power in numbers as well with that. We've got just about 4 to 5 minutes left here. So selfishly, I would love to ask a question that I'd like to know from all of you amazing folks. So I know that all of you are extremely passionate and expertise, have so much expertise, and I can hear it coming through your voice. And I can't imagine the hours you all put in a day, much less a week, when you're doing your work and the work that you're doing for the communities in addition to that. So can you tell myself and the rest of the folks in the audience who are primarily folks of color who are also very passionate and leaders within their own rights, what are you doing to take care of your own health? What things do you do to make sure that you're able to take care of yourselves while you're doing this work and continue to succeed through a pandemic as well? So feel free, anyone to chime in, but I'd love to hear a couple of thoughts that you all have.
Oh, this one's always a tough one when it comes up because I feel like that's the part that I really fail at. So I think giving yourself a pass when you're trying your best to do it, I think it's an acceptable answer as well. But I for me, that space of connection is very important. So I think many of us probably do the work that we do because we have passion and we believe that change needs to happen and voice needs to be persistent and consistent, and we need to really be there advocating and getting into all these different spaces. But we also feel at home in those spaces, and I think it's a very interesting dynamic where it's exhausting and it's really, really hard. But I wouldn't want to be doing it with any other people than the people that we do the work in the community, because it means so much to be alongside people when they get you. So there's a sense of support and social capital that comes with that I think is really amazing. And, to echo some of the points that Dr. Gonzalez made too, like how are we very intentional and mindful at keeping those systems of oppression out, and really watching each other's back and being very intentional about how we support each other, I think is very, very key. Here locally, there was one initiative where I felt like our community came together in amazing ways when the Goodman South campus was being built on the south side of Madison, and all of us, all the different faces were there saying, this is what we want in our community because this is what we need in our neighborhood for the benefit of health, of well-being, and all of that. It was just incredibly powerful. So as much as I get myself in those spaces, the better I feel, but it's a lot of work as well.
I would say just making sure to practice radical self-care, being intentional about doing something to bring yourself joy every day. We cannot pour out if we ourselves are empty. We can't walk around, go on an empty gas tank because then your car will break down. And I have had my car run out of gas, or my husband had to save me more times than needed because I was ripping and running and didn't take time to fill up the gas and didn't even realize, man, my whole car broke down. So we can't do all these amazing things and help other people if we're breaking down on the inside. So sometimes it takes saying no. Sometimes it takes setting boundaries so we can pour into ourselves. We have to practice joy intentionally and unapologetically if we're going to be able to bless others. So personally, for me, some things I like to do, I'm on a kickball team. We're actually in the championship game tonight. So pray that we win. I love to go swimming. I love to go riding on boats and going to just laugh and have joy with family and play Monopoly. I'm very competitive in Monopoly, so be careful if you want to play me. But it brings me joy, and you have to just, at the end of the day, sometimes just do the things that bring you joy and happiness so that you can serve others.
I echo both Karen and Dr. Zapata's comments, but I think I get recharged with my grandsons. I have a 2-year-old, a 10-year-old, and a 13-year-old. And so baseball this last year has been a big part of our lives, and very proud of them. They also got a puppy who, well, he's a year old now. And I think I'm the one that walks him the most. So that's been really helpful over this last year as well.
and I will skip because you don't want to hear Hispanic male really emotional.
Thank you all. I sincerely cannot thank you all enough. You are all brilliant. I was a fan of each and every one of you before this. A super honor to be able to speak with you all today. And that has just gone up and it has been surpassed any expectations I had. So thank you so much for joining us, sharing your work, your life, and yourselves with us and with our communities now and going forward. So just thank you all, and thank you all for tuning in to this as well. I want to bring back Henry Sanders to give us some closing words for the summit today.
Well, first, thank you, panelists, for joining us. And I know that you all are busy and you're doing a lot. And I love how you ended it, Opal, on how do you take care of yourself. I've seen a lot of leaders who've done a lot of stuff and given a lot, but they've burned out. They can't do the work for a long term. And we need all you wonderful people being able to have sustainability because there's a lot of work to do and there's going to be a lot more work to come. So thank you for that question, Opal. Karen, thank you for joining us. It's always so good to see you and all the wonderful work you're doing with that Centro. So thank you. I really appreciate you and all the stuff you're doing. Opal, I'm such a big fan of yours. I'm a groupie, really. I think that if you ever heard her spoken word, you should. She is a fabulous, fabulous artist, talented, gifted. Not only the work she does at CUNA, but she is just a wonderful artist. So thank you for everything and moderating. And Gail, thank you for coming back and saying yes. You could have said no, and I know that you're always busy, but you've come back and represented. So thank you so much. We appreciate that. It's always an honor to have you. And Dr. Zapata, I know you are busy and running around. You said Monopoly, though. I think I can get you. I think I can get you know what I'm saying? Like, I don't want to, but we'll see. I don't want to hurt your feelings, but I actually do want to hurt your feelings.
Okay, I'll take that as a challenge.
It is what it is. It is what it is. No, thank you, Dr. Zapata. Thank you seriously for all you're doing. And I've actually seen some of your videos and PSAs. And so thank you all you're doing for helping people get vaccinated. So thank you for that. So our communities need it. And Dr. Gonzalez, thank you, sir, for doing what you're doing. And I disagree with you. I don't think there's anything wrong with seeing a Hispanic male being emotional. I think our young males need to see that more often. So that's just me. I'm saying, but thank you for joining us. I know you are busy and this is the first time, but welcome to the 365 family, sir. And I hope you'll come back and join us when we do this all the time. So thank you again. And thank you for all the people who are watching. This is day 4. 20 panels down, 5 more to go tomorrow, and over 25 panels we'll have this week. We have our award show tomorrow at 5:30. So if you can come, sure, that'll be on Facebook Live also, so come check that out. And tomorrow's a unique day because tomorrow's our affinity panels, and we are a multicultural, multi-ethnic media outlet, and we love that about what we do, but we also recognize that there are also unique histories and unique challenges in different groups. And we want to give them a chance to educate us tomorrow of some of their unique challenges and some of their unique histories and also how they will overcome some of those things. So that's what tomorrow is. So enjoy that if you can. See you tomorrow at 8:15. And thank you for everyone who's been sticking with us this long week. And thank you for all the panelists and moderators again. And we will see you tomorrow at 8:15. Take care. Thank you again.
This is 365 Media.